Good afternoon, everyone. I'll just give you some brief information about this swine influenza strain. And what we know is that the swine influenza, this strain of swine influenza A, H1N1, is a resultant swine virus. That means it is actually, it comprises of gene segments from avian, swine, and human strains. And this particular strain of swine influenza A has never been detected by the US or Mexico or any other country. So it's a new strain. The clinical illness ranges from mild influenza symptoms to severe viral pneumonia, and deaths currently have only occurred in Mexico. We know that the infection caused by this virus is susceptible to oseltamivir, which is Tamiflu, and zanamivir, which is Relenza, and is resistant to amantadine and ranitidine. Before I go into the global situation, I thought I would just spend some time on the differences between influenza and SARS. So although this is a new strain of swine influenza virus, the disease that it causes is not new. Influenza has been with us for eternity almost. And so some of the differences, in influenza, we have a 24-hour pre-symptomatic infectious period. That means before a person even presents with symptoms, he is already infectious 24 hours before this. Okay, so he could look normal, and within 24 hours, he would start showing signs. If you contrast this to SARS, there was no pre-symptomatic infectious period. That means only at the point when he became symptomatic, that means having fever, did he become infectious. In influenza, the peak infectious period is really at the start of development of symptoms, so that at the first few days when the patient develops symptoms is the time he's most infectious. If you look at SARS, the peak infectious period really happened during the second week after development of symptoms. So a person with SARS, harbored, being unwell for a couple of days, 5 days he had fever, other kinds of feeling of unwellness, and then maybe he'll go see a doctor 4 to 5 days and then get admitted. So he really was getting into the hospital at the time, or seeing treatment at the time he was most infectious. So the time that he spent in the community, his infectiousness was actually not the greatest at the whole period of his illness. But you look at influenza, before he might even go and seek medical care, between the first few days, he's already the most infectious. And in influenza, up to 1/3 of the cases are asymptomatic. So of all the people who get infected with influenza virus, 1/3 of them do not show any signs of illness, but can still be transmitting the virus. In SARS, this is very different. Almost all patients who got infected with the SARS virus exhibited symptoms. So these are very key differences between influenza and SARS. And these key differences actually also dictate what the control measures and what the differences are in how we manage an outbreak of influenza and how we would manage an outbreak of SARS. So the key differences in these actually mean that influenza will be harder to contain than SARS because it has a pre-symptomatic infectious period. The infectiousness is highest in the early stage of the disease, and 1/3 of the people will not show any symptoms. So when you talk about contact tracing, it will actually have its benefits only in containing the disease in the initial phase of the outbreak. Let's say in trying to control, imported cases coming, we try and identify the person as quickly as possible and, give prophylaxis to his contacts, trying to prevent transmission further from this one case, this one imported case. But however, when there is already community transmission, contact tracing really will no longer be useful. And once it's spread into the community, there's really no benefit of doing contact tracing. So on the 25th of April, WHO convened an emergency meeting to assess the outbreak in Mexico and the US and declared it a public health emergency of international concern. However, they did not change the pandemic alert level from their current phase at that time of phase 3 to phase 4 because of gaps in knowledge on the clinical features, epidemiology, and the virology. 2 days later, on the 27th, they convened another emergency meeting. This time, the Director General raised the level of influenza pandemic alert from the Phase 3 level to the current Phase 4. This change to a higher phase of pandemic alert indicates the likelihood of a pandemic that has increased, but not that a pandemic is inevitable. I'll just go a little bit into the situations in the different countries. So it started in Mexico, and they noticed, from what they have noticed, is cases started as early as maybe February or March. And if they were towards the end of their usual influenza seasonal pattern, and they did notice a small increase from the normal pattern, but it was not a very significant increase from what they had known, what they detected at that time. And initially what they thought was this was just an unusually severe outbreak of seasonal flu. As of 27 April, the Mexican health minister said that Mexico's probable death toll from swine fever rose to 149 with 20 lab-confirmed cases. The WHO spokesperson also said there were at least 26 lab-confirmed cases in Mexico. And as of yesterday, they reported that the cases had risen to 152. But I must elaborate that the numbers keep fluctuating, so we're not quite certain exactly what the confirmed numbers are. So some measures that have been taken in Mexico as of today, they have closed all the schools and universities until further notice. Restaurants have been ordered to only serve takeaway meals. Bars, clubs, movie theaters, the other place, all these public places have been told to close until the 5th. They're considering shutting down their bus and subway system. And citizens have been asked to avoid large crowds, refrain from kissing, and stay at least 6 feet from each other. So these are really community distancing measures, because really the control of influenza is out in the community. So to prevent people from, passing from one to another, to keep people away from each other as far as possible. In the US, the latest is that they have 65 confirmed cases, 10 in California, 6 in Texas, 2 in Kansas, 45 in New York City, 1 in Indiana, and 1 in Ohio. There are currently 5 patients in hospital, 3 in California, 2 in Texas, with age ranging from 7 to 54 years of age. The initial cases reported were reported to have self-limiting disease. So it's just that over the past few days, they've reported about 5 patients in hospital. The US also over the weekend declared it a public health emergency. Washington, D.C. has issued a travel alert warning against non-essential travel to Mexico. And they're releasing 25% of the national stockpile of antiviral drugs. In Canada, we have 4 confirmed swine flu cases in Nova Scotia and 2 confirmed cases in British Columbia. The latest information that we have on the 4 cases in Nova Scotia were actually in students that had no travel history to Mexico, but were in contact with other students in the same school who had traveled to Mexico and who had fallen ill before. So this indicates that there was some degree of community transmission happening in Nova Scotia, or at least within the school. The 2 cases in British Columbia had independent travel history to Mexico. So this is a list of the status as yet. On the left side, you see the countries with confirmed cases: US, Mexico, Canada, New Zealand, Scotland, Spain, Israel, and Costa Rica. We are only considering US, Mexico, affected states in the US. That means the states which have cases where there might be some degree of community transmission, whether early. So they are California, New York State, Texas, Kansas, and Indiana. The state of Ohio, it was in a returning traveler, so we have no further evidence that it was spread beyond, so we're not considering it as an affected state. The whole of Mexico, the whole country is considered an affected area. In Canada, only Nova Scotia, because there is some degree of community transmission. British Columbia, it was only in returning travelers. The other countries, what they are reporting are imported cases. And these cases, there was currently at this present time no evidence of further transmission from these. So The other countries are not in what we have called affected areas.